Hello, everyone. Thank you very much for joining us today and spending some time with us. I'm John Paul from Cannes, and it's really great to see a mix of NHS and council public health people here. So thanks again for giving us a bit of your time. Today's about learning from the past, and particularly applying that learning to how we improve how we communicate across a range of public health campaign areas this winter. Every winter seems, from our perspective anyway, to get more and more challenging for you guys. More demands, later and delayed decision making, tighter budgets. So what can we do? Well, we've brought together a range of experts in various fields, and the idea of today is to give you some inspiration, some new ideas to help you plan your winter communications this year. So I'll do a quick whiz round. We have David Morgan from 22 Design. We have Dominic Ridley-Moy from the Behaviour Change Network. And we have Dan Hare from eShot, and we'll be sharing a range of things that you can do and potentially implement this year to assist you in delivering more measurable outcomes. So we'll be covering data and insight that sets the context. Dominic will be looking at applying behavioural science to the challenges that we face. David will be looking at the creative and messaging and applying that behavioural science into the messages that we do. And then Dan and I will be giving you some ideas for tactics and channels and ways we can work together. So we're going to zoom in a little bit on urgent care. The data says that there's a steady upward trend in non-urgent attendance at A&E, and that this is not static across the country. It's certainly very different, with huge ranges in the numbers of people that turn up to A&E with non-urgent needs. Being a young parent or being from a low-income household increase one's propensity to attend A&E non-urgently. And a lot of the non-urgent symptoms include things like respiratory, fever, asthenia, and vomiting. Now, for us as communicators, the challenges really are finding the right people and getting the messages across to them at the right time with the right frequency, and then demonstrating back to the powers that be that our communications correlated with some sort of outcome, reduced use or increased use of other services. And so, as always, when we work at Cannes, we really like to work with Dominic from the Behaviour Change Network, because he's able to sort of take a kind of bird's eye view from this, from a behavioural science point of view, and give us some of the tactics and approaches that will help us deliver outcomes. So Dominic, over to you.
Thank you, John Paul. So yeah, I'm just going to say a little bit about the theory and some of the models you can use, which you may be be familiar with. But just to think about some of the things you can do, those kind of very basic things that will make such a difference for a campaign like this. I'm just going to talk briefly about one of my favourite models, the COM-B models, which is one of those super models that looks at all the different behaviours out there, brings it together in one super framework and thinks about how can you solve these problems. And then EAST as well, developed by the Behavioural Insights team, which is very much around kind of what do you do to solve those problems. So I think for me, it's very much thinking through and doing that upfront thinking. And that's why I've kind of put it in the top right, and I think it's timely that we're having this now, because I think one of the biggest mistakes when we're all time poor, and even if we're not sometimes, is not to do that upfront thinking. And for me, I do a lot of behaviour change campaigns and work with organisations. And when you haven't thought through the behavioural barriers and the behaviours and what the problem is, that's when your campaigns aren't as successful, as I'm sure many of you will be aware. So always do that upfront thinking. So for me, what is that kind of upfront thinking? It's thinking through, I suppose, those kind of those key touch points and spending more time in that planning phase. So thinking, when people need help, what do they do? And being very, very clear about having that kind of audit trail. So do they ring the GP? Do they go to the pharmacist? When you're thinking about I possibly need to go to an A&E, relative needs to go to an A&E. Where is it they look? What do they do? And having that really clear understanding. So I think for me, you could probably break it down into two elements. It's at the time that people are making the decision when to go to A&E, or are they? What do they search for online? Are they using a mobile? Are they using a tablet? All those kinds of things, and having that very kind of clear answer to that. And sometimes it's not always as obvious as you might think, and a lot of the time it's just thinking that through in a bit more detail. Trouble is, you won't always have the answer to that. So I think John Paul is going to talk later about more than a kind of always on approach and having a kind of sustained campaign, because it's that time when you decide what to do. And I know from my own personal experience, my mum's elderly, she's got dementia, she's got diabetes, and there's been loads of times where I know I've done the wrong thing in hindsight. So I couldn't find the information quickly enough. And that's so important when you want to go to A&E. If you've got a child that's sick or an elderly relative, you're thinking quickly. So you need to attract people's attention. If the information isn't easily available on the website, you're just going to give up and think, I'm going to go straight to A&E. And I've done that so many times. I couldn't find the information quickly, so I just went straight to A&E, when that's definitely not the right thing to do. I mean, there's other motivators, like because my mum's got diabetes, often it's because she didn't have a diabetes plan properly in place. So it's thinking about, I suppose, what those quick motivators are. And a lot of the time, I suppose it's that thing that you want to get seen quickly. And for me, that's a bigger motivator than other things. So I'll try and find that, but not always one we necessarily think about. So I think it's about kind of breaking it down into the sort of, as John Paul said, what are the quick wins? What are the areas that we know there's pent up the demand, and then getting that clear picture of what it is people are searching for. How quick and easy is it to find information on the website? When people make the decision, where are they? When are they? Is that in front of them at the time? What happens when they ring up the GP? Does the GP have a script? Does the pharmacist have a script? Are they all trained and part of that process? So I think for me, it's always that kind of doing that upfront thinking about what it is that you can do, what's happening, when and where, and that will make your campaign so much more impactful. So that was just a very quick whistle-stop tour of some of the behavioural thinking, and I'll hand back to John Paul. Thank you.
Thank you, Dominic. No, and we find that working with you helps focus our attention on exactly the right things, and some of the qualitative stuff you do with the people actually delivering the services on the ground is very impactful and very important in terms of shaping what we do, and having that framework to explain to people why certain messaging is happening is also critical. But then taking that theory and then developing a range of different messaging is another challenge that we sometimes face. And David has from 22 Design has quite a lot of experience of doing this. So David, would you like to take us through your experience and learning around developing effective creative?
Yes, absolutely. Thank you, JP. I think just moving on from what Dominic's just spoken about with regards to behavioural change campaigns and doing the upfront thinking, making sure that you are meeting the audiences where they are most likely to be at the time that you want to contact them. And then also ensuring that when you do reach out to them on whatever channel it is that you are speaking to them on, that you're using the appropriate creative. So by appropriate creative, I mean that you're representing the audience that you're talking to in the ads that you're creating. And not only that you're talking to them in a voice that they will react to and respond to in the way that you want them to respond. We've run a number of campaigns, the Stop Smoking campaign, Stop Smoking London campaign in particular, where we were targeting a younger audience, and with the creative that we came up with, we used sort of emojis and ways of looking at the audience and how they were communicating with each other and communicated to them in the same way. And also, it was really important to use positive messaging. So rather than trying to get people to do something by telling them what they're currently doing is wrong, but actually encouraging them to do it, showing the benefits of to them of what that behavioural change will do. So rather than saying don't do this because it's going to give you cancer, make you sick, do whatever the sort of traditional stop smoking campaigns have done, but actually telling them how much more money they would have, the benefits to them. And we found by doing that, that we got far better results, far more quit attempts, and actually changed people's behaviour. I think the other thing was that representing so in this particular instance, it was young people we were talking to, making sure that we represented the young people in the advertising that we were putting out there. And also making sure that if we were, so the boroughs that we were speaking to, we were representative of the people that lived in those boroughs. So we were representative to those particular communities. And sometimes those harder to reach ones, again, to sort of Dominic's point about doing that upfront thinking, that you have to tailor the messaging to those people. So we would typically create a messaging matrix and lay out all the different messages that we want to tell to the different audiences that we're speaking to and the different channels, and make sure that we match those up so that there's a sort of dynamic approach to the advertising. And luckily, certainly in the digital arena, we're able to do that, and most importantly, we're able to test that. So when we start a campaign, we never assume that it's correct when it starts. In fact, quite the opposite. So we're always looking to improve it, seeing what's working, seeing what isn't working, and changing that messaging, changing the imagery accordingly, so that by the time we get to the a couple of months into a campaign, we can sort of definitely say that it's having the desired effect. Yes, so I think obviously that time is important at the beginning to make sure that what we've got is planned, where we know who we're targeting, we know what channels we're targeting those people on, and what the messaging matrix looks like, and what the imagery that we're going to use looks like as well. So yeah, that would be my my sort of takeaways from this.
Thank you, David. And yeah, we saw running these creatives with you that using positive messaging more than doubled the interaction rates, framing things as the sort of behavior change theory posits, that it's socially attractive, easy, accessible. These prioritizing those, we saw straight away in interaction data huge increases in terms of how people watched and resonated and interacted with those creators. So we've got the sort of the theory and the data from the services, then the messaging framed using the people or using representatives of the populations that we're trying to interact with, and a multivariate range of prompts to nudge people towards the right sorts of optimal sorts of behaviours. The next challenge is how you then start to improve impact. We'll get into specific tactics in a moment, but we've seen a sort of evolution over time, particularly accelerated by COVID, around these sorts of campaigns, where you're moving away from total or dominant use of broadcast media, taking centralized messages, and then talking in very large terms about the number of people reached and so on by a campaign, and moving much more towards always on, long-term intervention and nudge type campaigns. We're also seeing a lot more use of public sector channels and audiences, so working between councils and ICBs and other NHS organisations, and then also taking service data and mapping the impact of communications against changes in service data usage. The benefits of all this approach is that it's much more cost effective. You get far more measurable outcomes for your budget. But you also create much more sustained behaviour change as a result of it. So the use of certain new technologies and channels, and maybe the less reliance on old broadcast ones, seems to be the trend. And I think that's something we need to accelerate. Now, one relatively underutilized channel, in our opinion, is email. Every time it's been used in a campaign, the results have been staggering. And that's why we've partnered with eShot and Dan Hare. And Dan, I think you're going to share a few resources and ideas for the people on the call. There you are.
Thanks, JP. Yeah, can everyone hear me?
Yeah, we can.
Great. Okay. So, yes, talking about old broadcast mechanisms, email, the massively underutilized channel in this marketing mix. So I am a bit biased. My specialism is email, so I'm going to extol the virtues of it today, but we'll do it in the context of what JP's been talking about more generally. So although we specialize in public sector comms, we're part of the Data and Marketing Association, and we participate in their research, which looks at channels more generically across a range of consumer brands. And what we hear from them every year consistently is that email is the best channel brands can use across the customer journey. And when we look at the data behind that, the popularity of email is kind of off the scale compared to what we see with others. And as JP says, that's kind of borne out of the data where email is leveraged as part of a campaign. We see quite exponential improvement in results. The other thing is email is incredibly cost effective. So your CPMs in email are often a fraction of what they would be in any other given channel, regardless of the effectiveness. However, when we look at what happens in these sorts of campaigns, ordinarily email is painfully absent. And indeed, if we look at current resources available, we browse through the various toolkits and campaign assets that are made available. Lots of posters, lots of social ads, pretty much everything you could possibly need to get the message across apart from email. So there's a missing piece of the puzzle here, which I'm talking to JP about potentially helping to fill. And I want to leave you the two ideas today in terms of things that you could potentially do to stop having that gap in the comms mix. First off, look to actually create emails as part of your campaigns and toolkits. And indeed, we have already been doing that. We partner with an organisation called LG Comms, and they have about 6,000 comms professionals working in local government. And for the last 18 months, we've been taking national campaigns, things like Help for Households, Adult Social Care, as you see there. And indeed, last year we did create email assets for quite a few of the winter campaigns to give our local council customers and indeed our NHS Trust customers the assets that they need to be able to communicate with their audiences. So this is very much them using national campaigns to use email at a local level, but there's not much stopping us doing this at a national level as well. One of the reasons that we're often given as to why is email left out of this mix, well, we don't have the audience, and obviously sending emails and being seen as a trustworthy source can be challenging. And you're absolutely right, it can be. Fortunately, we've been doing this for a long time, about 20 years, and sending from gov.uk domains, sending as a verified source. There's a lot of boring detail to it, but the expertise does exist to be able to send out emails reliably and be seen as a trusted public sector source. The other thing with that is, when you think about email as a broadcast channel, no, it's an awful lot more than that. So it's not just about building a couple of email templates and banging them out to whoever you can. It's about using email to build journeys as well. And indeed, those journeys can be entirely email based or can be mixed in with other channels. So for example, if you have ads to mitigate A&E admissions by promoting the fact that you can go to the pharmacy instead, you could offer a simple utility of entering your email address to receive a summary of those pharmacies that you could go in as a kind of utility. You've seen it online, but now get an email so you can go back to it later on and see that list of pharmacies. You then automatically send another email, maybe a few hours later, maybe next day, with further online resources and advice, you know, to provide self-help. And then, you know, depending on the message and the complexity of the subject matter, that could continue into a much larger sequence of communications, or indeed it could be a simple kind of square off with something like a feedback and further help email, where you can do things like single question surveys in emails very easily. So you actually get some measurements. So, okay, we tried to deflect you from A&E to the pharmacy. Did that work? Give us the feedback. Did you go to an A&E? Did you go to the pharmacy? So there's potential to use eShot both to use email both to you know, get that behavior change, but also to help measure it as well. So as I say, first idea, you know, use email more as part of the marketing mix for these campaigns. The second is to use established council and NHS Trust email audiences. So as I say, we produce a lot of these templates for our local government customers already anyway. They have the networks, they have the subscribers already to be able to reach people at a pretty targeted level. So what we know is that most councils do still have large email subscriber lists left over from the pandemic. Huge amount of people wanted local specific updates during the pandemic. They're still subscribed to those theoretically, and indeed we've worked with several councils to migrate those audiences from the kind of COVID updates to public health updates or other newsletter categories that they already have. So there's ready-made audiences potentially that you can tap into there. The other thing is those councils often have the ability to target people at quite a hyper local level. So they have address information, they have gender, they have other demographic values that you can use to be hyper targeted with things. So potentially, you can create your own emails, your own automated journeys and what have you. But what you could also do potentially is create those assets and then work with councils and with NHS trusts to leverage their existing audiences. And, you know, it's almost carrying adverts in existing newsletters. This is an example of one of our local council emails for Brent. And as you can see here, it's very easy to just embed adverts or other messages within those emails. And indeed, you know, email technology, despite being a bit old school, has moved on now. So we can do clever things like embed videos within emails. So let's say two potential things there. Consider email more as a channel to use for yourselves, but also potentially leverage those existing networks, those existing audiences of subscribers with councils and NHS trusts.
Thank you, Dan. That's brilliant and really interesting. An often overlooked channel, and whenever we've incorporated it, it's worked amazingly well. Often, you know, councils have many tens of thousands of subscribers to these channels, and the open rates are sometimes hundreds of thousands, yeah, and the open rates are 10, 20, 30, 40%. So you can really generate a lot of awareness and interaction using those. On that theme, there's email. We're also looking at using council audiences, council website audiences. So there are a range of services on council websites, for example, registering a birth or housing benefit or application for a range of benefits around the cost of living, which will help us target audiences we know will want to be targeting during winter. So using display advertising online in those contexts, and also then remarketing from council audiences. So we can see this huge opportunity for council, NHS, public health to work together to reduce cost per outcome, cost per person reached, and then cost per interaction over campaigns. So this is something we're really working on developing. And when we plan together, we're able to achieve some of these benefits. Another piece of technology that we think could be particularly useful in this field is the use of footfall analysis and alert notifications based on location through apps. So there are a range of apps that usually operate in any one area: travel, weather, parking, for example, that need location turned on. And what we'll be trialling this year with anyone that's interested is to map every A&E, GP surgery and pharmacy in a certain location, and then get anonymous footfall data between those. And then building on that, the ability to then target certain devices in certain locations with certain messages. This starts to hopefully get over the problem of having to use macro data to target people who may be using suboptimal services. Yeah, we're developing this. It will involve a bit of mapping, then analytics, and then gentle testing of various alerts through various apps. We also have mentioned a few times in the presentation already, but the power of search. We're able to give everyone on the call today insight into what people are searching for in their area, and maybe how those trends are changing over time. This helps us firstly see the language that people are using in a certain area, but then also to target messaging to specific symptom searches. So when people are typing in respiratory asthenia, vomiting, sickness and things like that, we can place adverts in shot that amongst the search results that nudge people towards the right service. Now, this is where we're getting into that sort of always on ongoing intervention, and we're trialing this in a number of locations and seeing very, very good cost per interaction, cost per post-click interaction as a result of it, versus, for example, using more broadcast channels. One thing that we alluded to earlier on is once you are using more sort of digital channels, you're able to measure volume by day of interaction and delivery. And then by collating this with service outcome data, you can demonstrate in a very simple way to the various decision makers that you have a benchmark pre-communications, communications activity, and then a service outcome as a result of it. And I think correlating communications more tightly with service outcomes is critical to sustaining investment in those communications. Also, when we're all measuring together, our chances of finding top performing tactics messages and then sharing them between the group also increase, so that as David was alluding to earlier on, the messaging and strategies that you start with probably won't be the ones that you end up investing most in, and that ability is also, really important to, in near real time, optimize and improve campaign performance, thereby further reducing cost per person reached and cost per outcome. Now, I apologise for the layout of this slide, but this was really the best way that I could put in there for you. You can start to see we're talking more about councils and NHS working together on these problems. Now, beneath those are you have a range of different communications plans and strategies, but those messages are all going to some pretty frequently occurring audiences. So speaking to parents about childhood immunisation, speaking to low income households about the cost of living. We expect this pressure to come back a lot this year, sadly. But finding opportunities to cross-pollinate between campaigns, we think, is another opportunity to further reduce cost per outcome. And so where possible, understanding what's coming up and seeing how those various campaigns might prompt outcomes for each other is another area that we're developing. But again, it requires the people on this call, councils and NHS, to work closely together. We are doing our best now to bring all of these ideas together and create custom plans, proposals, suggestions, ways of illustrating what could be done and when, a critical component of this being starting earlier. Often we've had campaigns that kick off in December and January during the stress period. What we want to be doing is running analytics, running insight, finding out exactly where the problems are and starting to address those in autumn, so that then the pressure is relieved and those behaviours can be sustained throughout winter. Also looking at the potential for cross-pollination between campaigns. So can we take health checks and cost of living and mental health campaigns and share outcomes and audiences between them, again, to reduce cost per outcome across all of those areas. So if you're interested in having that sort of conversation, we're more than happy to put one of these plans together for you and have a conversation about it in the next few weeks and months. I just wanted to point out that, you know, we know how stretched comms teams are. We've put this super team together, all experienced in public sector campaign delivery, all working for many years in this field, and all very passionate and motivated to have an impact on this. And these people are here to help you. We're doing a lot of the data analysis. We're doing a lot of the coordination, the pooling of campaign resources, and this is the team that will be hopefully working with some of you. So just to sum up, our top recommendations for planning for winter: start sooner. Have your plans in place in the next few weeks and months, and get approval and get going. I know that's a challenge, but if you're communicating in autumn, your chance of having a better winter will be better. Apply behavioural science to the messaging that you use and also to the desired actions that you have from the campaign. Then make sure that we take a range of multivariate messaging tailored to the local populations and place them in the right place at the right time in front of the right people. If we can, use as much of the public sector channel and audience estate as possible: remarketing to websites, use of email, cross-pollination between campaigns. And then those of us that work together on this, let's measure impact together and let's borrow from each other to improve campaign performance in time. Thank you again for spending so much of your precious time with us. If you want to have a further conversation, you can book a meeting with me here. Anyone else who you heard from today, they're all more than happy for you to email them directly and get in touch. We'll be following up with additional ideas and data in the coming weeks and months. So thank you very much for spending your time with us today, and we hope to speak to you soon.